This week, federal healthcare cuts and affordability take center stage, and to look at how Regions Hospital is keeping people safe at the state fair. Welcome to the August 28th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Abby Mochtig.
And I'm Maddie McCurran.
Federal cuts to healthcare were in the spotlight this week as U.S. Representative Betty McCollum brought together voices from across the healthcare sector for a roundtable at Gillette Children's. Panelists discussed the impact of federal cuts to the Medicaid program, the expiration of ACA tax credits, and other reductions going into effect as a result of H.R. 1. McCollum pointed to the downstream impacts on hospitals, patient health, affordability, and the entire ecosystem. About 17,000 Minnesotans have already dropped their MNsure health coverage, and more than 140,000 more Minnesotans are predicted to lose Medicaid coverage.
When you can't afford health care, like I said, it affects everything in your life. Preventative, it affects acute care, and then it affects how you afford to go to a hospital, or even when you go to the hospital. We want you to come to the hospital early when your doctor says that you can, but you don't go if you don't have insurance. You put it off.
McCollum also decried the federal government's move to withhold $500 million in Medicaid funding from flowing to the state, describing it as an attack on every single Minnesotan. The Minnesota Hospital Association's Director of State Government Relations, Danny Ackert, highlighted other stresses that are pushing hospitals and health systems to the brink.
The cost of drugs, supplies, and everything else that it takes to care for patients are at historic highs. Those are costs that our members absorb, not prices we set.
Minnesota Senate Majority Leader Aaron Murphy, MNsure CEO Libby Callum, State Medicaid Director and Minnesota Department of Human Services Temporary Commissioner John Connolly, and the Gillette Children's President and CEO Barbara Jors also spoke at the event. And at the state capitol this week, GOP nominee for governor and Minnesota House Speaker Lisa Demuth laid out her plan to address affordability during a press conference. Maddie McCurran has more.
Demuth's plan largely focused on rooting out fraud in Minnesota's social safety net programs, which she credited with driving up the cost of living for Minnesota families. If elected, she would direct her administration to find $1 billion in savings across all agencies.
That is where the state's responsibility is. Making sure fraud ends, respecting and protecting taxpayer dollars, and getting this back on track.
Demuth's affordability proposals also include cutting the income tax rate for the state's lowest earners, eliminating the state tax on Social Security benefits, and capping all car tab fees at $99. During the Capitol press conference, she also floated potential changes to the state's paid family and medical leave program.
We are not looking to repeal the paid leave program right now that is set to go, but what we want to do is put in guardrails so it can't be wasted, and we would like to put in some common sense things that we are hearing from businesses that would make it more workable.
Demuth's affordability agenda didn't directly address the healthcare sector, but her campaign signaled that a specific healthcare plan is on the way. Senator Amy Klobuchar, the DFL nominee for governor, has her own affordability plans. Klobuchar and other Democrats are pointing to the federal government's moves as the main driver of increased costs for Americans, such as the extensive cuts to Medicaid signed into law last summer. Klobuchar has said that she plans to create a state tax credit to offset health insurance premiums, should Congress again decline to reinstate the federal subsidies that expired last year.
And in Washington, the Trump administration this week proposed a more than $100,000 fee for H-1B visa applications for skilled foreign workers. This is an updated version of a policy the president put forward last year that was ultimately blocked by a federal judge. Ellen Florek has the details.
There are a few key differences between the two versions. Rather than imposing the fee through a presidential proclamation, the Department of Homeland Security is now invoking its rulemaking and fee-setting authority, characterizing the payment as a cost recovery for administering the immigration system. The fee would still have far-reaching implications for businesses that rely on the H-1B program to fill jobs. However, new H-1B hires by hospitals, universities, and research-based institutions could be spared under the new proposed rule if they are cap exempt. The size of the fee makes it likely to invite renewed challenges over whether it requires congressional authorization to impose.
And finally, the Emergency Medical Services team at Regions Hospital is marking its 18th year as the official first aid provider of the Minnesota State Fair. A staff of emergency medicine clinicians are operating 2 aid stations and will have other first responders spread throughout the fairgrounds. EMS Medical Director Dr. Nick Maleska told Fox 9 the team will see an average of 4,500 patients over the nearly 2-week period.
We see everything that you would see in a city of 200,000 people. Some things might be just indigestion from too much good fair food. Sometimes we see bee stings, we see trips, we see falls. And we do see more serious things like heart attacks, strokes, and sometimes even cardiac arrests.
With nearly 2 million people expected to attend this year, Regions is offering some health and safety tips to fairgoers. Drinking plenty of water and wearing sunscreen can make a huge difference, as can bringing along any life-saving medical interventions that may be needed in an emergency, like prescription medications, insulin, inhalers, and EpiPens.
If those things fail, making sure that if you're starting to feel lightheaded, muscle cramps, excessive sweating, or feeling a little bit nauseous, that's probably time to either take a rest or find one of us at one of our aid stations so we can help.
The State Fair runs through Labor Day, September 7th. That's it for This Week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Abby Mochtig.
And I'm Maddie McGurran.
Thanks for listening.